So hey guys, what's up? So welcome to World News 20 news channel. So let's talk about where does virus grow from here. On Sunday, the number of people infected with novel coronavirus in India crossed the 1,000 mark. There are 40 countries who have more people infected. The death toll in India reached 27. The count is higher in 30 other countries. These numbers would suggest that India is in a relatively better and even if still difficult situation. But this is not simple. There are scientists who are saying that over the next 2 months, the number of infected people in India could cross a million. There are others who assert that the community transmission of the virus must already be happening, and these are not getting captured because India has not been testing enough number of people. The Indian Council of the Medical Research (ISMR) has been maintaining that despite the emergence of the few cases for which the original source of infection has not been traced, there is no community transmission happening. That there are research papers suggesting that the survivability of the virus weakens in high temperature, and some have used this to explain the relatively low infection rate in India. In the mindset of all this, an unexpected humanitarian crisis in the form of the desperate movement of the migrant laborers threatens to undo the benefits of the largest ever lockdown imposed anywhere in the world. How these desperate and some of them conflicting elements explain the current health crisis, the picture that emerges is still not complete, but it does indicate how these elements are joined together, and this is how it looks like. The possible pathways. Let's begin now this most important question: how will this end? When a new virus outbreak happens, there are three predictable scenarios through which its spread can be contained. Though at source in this scenario, every source of the transmission is isolated in the context of the spread in India. For example, this would have in meant identifying and isolating every incoming foreign traveler carrying the virus to ensure that they did not pass on the infection. It is almost certain that this has not happened, otherwise the daily detection of the new positive cases would have at least slowed down, if not stopped. A week after all incoming flights were stopped. That has not been in the case. Community transmission. This when the virus gets into the community and infects a substantial fraction of the population. The more vulnerable in the population die of the infection, but in the process the population develops an immunity to the virus, after which the infection slows down and eventually the virus is rendered ineffective. This is the principle of the herd immunity. This situation becomes more or less inevitable once community transmission begins. The size of the population that gets infected before the immunity is developed depends on many factors, notably on how fast the disease is spreading, how many people are infected on an average by every infected person. This entire process can normally take 6 months to a year. As of now, scientists do not know how long this period could be in the case of the SARS-CoV-2. In any case, this process can be very painful depending on how little the virus is vaccinated. This is a situation in which a vaccine is developed and administered to every vulnerable person. By all accounts, we are at least 12 to 18 months away from the developing a vaccine for the SARS-CoV-2. By that time, the herd immunity scenario would have been played itself out. Two or more possibly theoretically, there could be the other two scenarios as well. Virus fail to survive. There arises when, due to some reason, possibly unsuitable climatic condition, the virus is not able to survive long enough in a geographical region, thus losing its potency to infect large numbers. Some scientific research has indicated a vulnerability of the virus at high temperatures, but the evidence is not yet conclusive. On the other hand, the fact that the virus has survived in India for more than a month and continues to infect a large number could be offered as a counter-argument. Pre-existing immunity. This could happen if the population has a pre-existing immunity to the virus. In case of the SARS-CoV-2, there is no evidence to suggest that the Indian population has any special pre-existing immunity, even if through the rate of the spread of the virus has been slower in India than many other places. The most plausible, most scientists agree that the SARS-CoV-2 would follow the second scenario in India, community transmission leading to the possible eventual immunity, although there are very few recorded cases of the community transmission as of now, and even these are the contested. Scientists see this scenario as far more likely than any other scenarios. The ICMR has acknowledged that there have been a few cases in which the original point of transmission has not been ascertained, but has insisted these numbers are so few that they do not establish community transmission. Scientists saying that the community transmission must be happening are not relying on any data. There is hardly any word or not from India as of now, but on their knowledge of how such diseases spread. But if that scenario is indeed playing out at some point of time, the spread could be rapid if no intervention is made to halt the spread, and infection would grow at an exponential rate. And very soon as a large proportion of the population would get infected, this would be in accordance with the projection made by several scientific groups using mathematical models. Such projections are based on a number of assumptions, including the kind of the intervention being made, their likely impact, and the expected behavioral responses of the general public to these interventions. Once a substantial proportion of the population gets infected and most of them recover, herd immunity will kick in and fight back, slowing down the infection rate. In the olden days, this is how most disease outbreaks used to be unfold. The death toll in these outbreaks would depend on the nature of the virus. If the virus is not very lethal, an argument can be made to let the virus spread in the community and herd immunity develop, and to what constitutes an acceptable death rate can be extremely sensitive issues. Reasons to be cautious. There are two reasons why governments would be extremely reluctant to take this approach to deal with the outbreak. In today's world, letting the virus spread and take its toll would be considered extremely unethical. As one of the an immunologist at the Indian Institute of the Science, Education and Research, Pune, put in, no government can afford to be seen to be doing nothing against the disease that is claiming lives, even if whatever it decides to do might not alter the final death toll very significantly. The second reason concerns practical difficulties. A very small proportion of the infected people, about 5 to 7%, require hospital care. But if the virus is allowed to spread rapidly in a country like India, that 5 to 7% would translate into huge numbers beyond what is medical infrastructure could handle. That is where the utility of the 21-day lockdown and other measures taken before that kick in. How lockdown helps? By confining a majority of the population to their houses, limiting their contact with other people, the spread of the virus can be significantly slowed down. It cannot be entirely slowed because there always would be some people, emergency workers, healthcare professionals, and those involved in essential duties who would continue to interact. Additionally, in this vast country, some people are always likely to flout lockdown instructions and continue mingling with others. Even if a very small proportion of these people are carrying the virus, it would continue to find new susceptible hosts and remain in circulation. A slowdown in infection rate due to the measures like the lockdown would also reduce the pace at which the herd immunity is built, but the most importantly, it would give authorities the time needed to wrap up medical capabilities, create emergency infrastructures, and prepare itself to deal with the large influx of the patients who would inevitably arrive. Achieving an optimum balance between these two objectives can be very difficult, says Bell. To be successful, the lockdown expects a mature response from both the general public as well as the government authorities by following instructions on remaining confined and social distancing. The people has to make sure that there is no run on the hospital beds, ICUs and ventilators, and the government has to ensure that it uses the spirit to significantly ramp up its capacities. This is already happening. Several cities and states have started marking a certain number of beds for the COVID-19 patients, isolation wards that are being created in trains. There are plans to convert large public areas like stadiums into makeshift hospitals dedicated to COVID-19 patients. Medical equipment are being ordered in large numbers. The other consequence, by shutting down railways, airlines and bus services, the government probably thought it will keep people where they are. What it did not probably factor is that people would walk hundreds of kilometers to reach their homes. Besides, the plan is that it has caused to individuals and beyond the humanitarian crisis that it has become. Such large-scale movement also seriously undermines the purpose of the lockdown. A large majority of the migrant workers who are desperately trying to reach their homes are driven by the fear of a city disease from which they will be safe only their native places, the fear of becoming socially isolated in a place which is not their own. Many of them have been saying that if they have to die, they would be much rather die in the company of the family and village community. Better communication would have eased the suffering. The fears need to be addressed not just in those who are desperately walking, but also among those who are getting increasingly paranoid in their homes and fearing they would get infected and die. All these people need to be reassured highly from high levels of the government that even if they get infected, most of them will likely to recover without major problems, without needing hospitalization. So if you like the channel, so kindly subscribe to it.